Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the study. In the hepatitis B virus, today we'll discuss about the window period. What do you mean by this window period? So if hepatitis surface antigen is present, and we know that definitely there is infection. And if hepatitis G IgG is present against hepatitis S antigen, then it suggests that either there is a disease is cured or the patient is vaccinated. Those are the possibilities because we are giving vaccination against the hepatitis S antigen. Okay, so if IgG is present, either the disease is cured or the patient is vaccinated. Both the possibilities are there. But there is only one exception, that is window period. What do you mean by window period? So there is a period called as window period. This is a time period when IgM is fighting against the hepatitis B virus antigens efficiently, and virus antigen are only few and does not detected in the blood serology. Okay, so this is a period where IgM is fighting and viral antigens are only few and IgG is not yet started producing. Okay, so however the body still not produced it. This is a window period. IgM is also fighting. So as it's fighting very efficiently, maybe IgM number may also to some extent increase or may come down. But IgG is definitely not produced. This is such a transitionary period. So this period is called as window period. Okay, so we should not get confused by this window period. So this is the stage where patient shows the absence of HBsAg. This is the stage where if you look into the blood serology, HBsAg is not there because IgM is fighting efficiently, and HBeAg is also not there, although the infection is still present in the blood. Okay, because IgM is efficiently fighting, therefore their number is less. So although in the presence of the infection also it shows that there is no HBsAg. However, there is antibodies. There is both IgM and IgG against HBsAg. core antigen के against जो antigen है वो है, but HBs antigen के against जो antigen के साथ थोड़ा कंफ्यूज हो सकता है, धोखा हो सकता है. So there is every chance of confusion that there is no infection in the blood if the serology is done during window period. So meantime IgG is also not formed. So this window period corresponds to in between 4 to 6 months of initial infection. So after 6 months there will be formation of the IgG, which suggests that infection is cured and the patient is priorly, either infection is cured or patient is priorly vaccinated. If you go for the vaccination also, after the vaccination a small infection takes place. During that small infection, mild infection phase, again IgM is produced. Then after 6 months of the infection, IgG start producing. So there will be a confusion. So how to differentiate cure and vaccination? Presence of IgG HBsAg in the blood suggests hepatitis B virus is either cured or vaccinated. If IgG HBsAg is also positive, then it indicates that previous hepatitis B vaccination is cured. If Ig of hepatitis C antigen is negative, then it suggests it is vaccinated. Now this is very important. So this, if C antigen is negative, then it is vaccinated. If the C antigen is also positive along with the IgG, then it indicates it is cured. Because antibodies against the core antigens will develop only if there is natural infection. Antibodies against the core antigens will develop only if there is a natural infection. So hepatitis B virus vaccination is aimed only against the hepatitis S antigens, not for the core antigens. So body produce antibody against HBsAg and not against HBsCAg. This is very important thing. Now talking about the carrier state, a person negative for HBs AG but positive for anti-HBs either have cleared an infection or have been vaccinated previously. Individuals who remain HBs AG positive for at least 6 months are considered to be hepatitis B carriers. Carriers of the virus may have chronic hepatitis B, which would be reflected by elevated serum alkaline serum ALT, alanine aminotransferase levels, and inflammation of the liver if they are in the immune clearance phase of chronic infection. Carriers who have seroconverted to HBeAg negative status, particularly those who acquire the infection as adults, have very little viral multiplication and hence they may be at little risk of long-term complications or of transmitting infection to others. So, however, it is possible for individuals to enter an immune escape with the HBeAg negative hepatitis. Now, this is actually how the antigen rise according to the time and all. I made a handmade image. May be clear for you. Acute HB, that means when there is acute hepatitis virus infection, what are all the antigen that will go into raise? Okay, during chronic hepatitis, what are the antigen which will go into raise? During recovering phase, what are the antigen that will go into raise? So everything is given here, and there is a graphical representation. These are the antigens. If you want to see, again the same thing. Lastly, we talk about the vaccine and then management, etc. So that we'll see in the next class.